you again for all the participants attending and our esteemed speakers, Dr. Ben Meisel, after all these years, Dr. Karen Raju, and also Dr. Clarissa Kripke. And once again, access to dental care is such a huge issue, as is seen by the number of participants on this. I know I've already had my own horror stories. It's still a challenge to get dental care for my son. It usually involves a lot of drugs, and that's just for me. Before we move into accessing all this care and general anesthesia. And I've heard plenty of stories from parents like mine, own experiences, where once we get that general anesthesia in place in the dental office, boy, are we ready to bring in the phlebotomist to do the lab work, the podiatrist to do the feet, cut the hair, cut the nails, and everything else while we can. So I'm very much looking forward to this discussion, and some of our objectives are really looking at the overview that Dr. Ben will provide on what's going on out there with dental care. We're going to be looking at the gaps in the policies to initiatives and how we might address some of these barriers. We want to get guidance from parents on how we can shape policy in the future. How we can advocate maybe for more specialty dentistry programs, and for getting a dental coordinator attached to the regional centers. I know in our own experience that's been most helpful for getting individuals of all ages with special healthcare needs and developmental disabilities the care they need. So without further ado, my sincere thanks to each of you. And Ben, here you go.
Good morning, everybody. Can you hear me?
Yes.
Oh, good. So I just want to first just thank everyone who's really worked hard on this throughout the state in trying to increase access to oral health care for people with special health care needs, both children and adults. There is certainly not enough dental care available for the size of the need. It is too difficult to access the dental care that is available for people with special healthcare needs who have a need for dentists and dental care providers who have specialized training. There's a poll question. There are 3 poll questions, and I'm hoping that you can all start answering those questions. So that we can look at your own personal experience for the people who are on the webinar today. So go ahead and answer those questions if you can find it. And we'll wait a couple of minutes while you do that. Are people finding the poll questions in Whova? Gina, Prashanth, are you seeing people answering the questions?
Yes, people are answering questions. Just let me know, Dr. Ben, if you'd like to see those results. And I'll
okay. Sounds good.
Thank you. Can't do it without our tech support.
Why don't we do 15 more seconds for people? Oh, thank you, Gladys Lopez, to tell us that everybody was supposed to do the questionnaire as they logged in. That's great. Okay, why don't we take a look at the results? So do you have a dentist able to fully care for your child with special health care needs?
Okay.
You would help us see that.
Let's see. Give me 1 second, apologies.
No.
Takes a little bit to share that screen.
Okay, so it looks like we have 36 responses and 15 out of, whoops.
Did we lose it? Uh-oh.
just for a second. So if you can go down on your screen a little bit, we can just see the yeses. Perfect. So we've got the poll there shows out of 36 responses, 15 of those, so a little bit less than half, 42%, do have a dentist able to fully care for their child with special healthcare needs, and 58%, or 21 out of 36 say no, they don't. Okay, how about the next question? What's the longest your child has gone without dental care because of their disability? What do we have? So less than 1 month. So, 15% say only less than 1 month. 1 to 6 months they've gone without dental care. Again, 15%. So another 4 out of 26. 6 to 12 months, 19% have had that length, so a year. And then 1 to 2 years, 19%. And then the big question, right? The big answer has gone more than 2 years without dental care. Can you go all the way down? I can't see the bottom of that, Prashant. So 30%. So the majority of people who've answered that question, more than 2 years had gone by without dental care. And then the final question, if we could look at that, what barriers to dental care has your child experienced? Long wait list, so 35%. Fear of dentist, 31%. Not willing to accept the child's insurance, 42%. Couldn't provide general anesthesia dentistry. Couldn't find dentists with necessary skills, that's 42%. Couldn't provide general anesthesia dentistry, 42%. Couldn't accommodate scheduling needs, 31%. Dental care is too expensive, 19%. And then other issues, looks like 15%, or maybe I was.
I think other issues is 19%, Dr. Ben.
Okay, 19%. Okay, anyhow, it's just that the majority of people, and I'll bet you there are people on this webinar who've had all of those issues be the challenge. So needless to say, maybe Karen, can you start sharing your our PowerPoint? So needless to say, there's an issue that everyone on this call can play a part in solving. And our largest hope is that this hour will empower all the families on this webinar to know some specific ways, some tangible ways that you can advocate and improve oral health care access for people with special health care needs in the state. I once said before a UCSF special needs dentistry summit that, hey, saving money, decreasing suffering, and increasing the smiles in San Francisco, who wouldn't want to do that? I mean, everyone's going to win when we solve this problem. Okay, next slide, please. So how many people are being affected by this? If we look at the number of people in California with disabilities such that they likely need a specialized dentist, for children, 0 to 17 years of age, there are 300,482 kids, roughly. And for adults in California, somewhere around 7,090,015 adults with a disability that likely makes them need a dentist with some specialized training. If you add those two numbers up together, you end up with 5,912,397 people, about 80% of that larger number who need specialized dental care, and 30% or so of those people needing general anesthesia dental care. And I can tell you that there's nowhere close to that amount of access in California at this point. Next slide, please. So in February of 2020, leaders in specialized dental care and special needs dentistry, and people at UCSF in particular pulled together legislators, agency leaders in order to talk about this problem. And from that came a number of different recommendations. And I'm just going to summarize them here and go through this list. One is that there needed to be a change in the training curriculum with more exposure to patients with special needs, and to have that training be more condensed so that when a provider is getting trained, they don't just see one person every couple of days, but there's a special needs dentistry clinic where they can see a number of different patients with special dental needs in one setting. The next one was medical dental integration. Believe it or not, most dentists in the state have a completely different electronic health record than most physicians in the state. So there is no easy way for scheduling to be done in a coordinated way. And so there's a really a huge lack of physicians and dentists training each other, interfacing with one another in the care that they provide, and coordinating that care. The next suggestion was to have endowed chairs of special needs dentistry at all California dental training programs. Not sure how that would get funded, but the ideal would be for the state to provide some funding to each of the dental training programs, so that there could be special needs dentistry experts at each of those training programs. Another suggestion was for there to be loan repayment for dentists serving Medi-Cal patients who are willing to see special healthcare needs patients. Another was that there should be a state-level interagency work group, so between the California Department of Public Health, the Department of Developmental Services, the Department of Healthcare Services, and the medical dental program at the state. Everyone should be, there should be a work group where those leaders are actually talking to one another. At that time, there was not that. And there continues to not be an official work group in this way. We wanted to get oral healthcare surveys put out in all counties, hopefully through the regional centers or through organizations that interface with families who have members with special healthcare needs. There was a desire for a dental referral support service. So some of the reason why dentists have difficulty seeing patients with special healthcare needs is because the need for a thorough history and physical exam to get all of the consents for care when someone has a developmental disability. Sometimes that's difficult to do. In order to know whether the disabilities that the patient has can be accommodated by the specific dentist who they're referring to. So a matching service to match the patient with the dentist. All of this doesn't exist at this point. Some individual offices have things like that, but for the most part, that doesn't exist as a service to all dentists. And if that service could exist, then it would increase the number of dentists able to provide care to people with special health care needs. There was a wish to create an insurance identifier, so as some way to identify patients who need specialized dental services, so that Medi-Cal and the funders of this service could feel comfortable opening up new dental codes. Because if they open up dental codes more generally, then there's a risk of fraud. And so the state is scared of opening up new dental codes that enable extra time to take for procedures or special procedures that are necessary for people who have special healthcare needs. So creating an insurance identifier. Another thing that was recommended was to add reimbursement codes to Medi-Cal for qualifying patients with disability, like we were talking about. To use something called interagency government transfer. So this is a way of drawing down federal money for people, for care that's provided by government funded healthcare organizations like UCSF and UCLA specifically. They can sometimes put money up front and then get paid back not only by Medi-Cal, but by the federal government as well. And currently that funding stream they have not been able to get that working yet, but that is hopefully going to happen in the near future. Creating a UCSF special needs dental center, that was a recommendation. And then to determine regionally where to build other special needs dental centers so that there is access to not only general anesthesia, but to other types of dental services closer to where families live who need that service. Next slide, please. So since the UCSF summit in February of 2020, a number of things have happened, efforts to move forward these issues. One is that Cavity Free San Francisco has created a subgroup on children with special healthcare needs to increase the number of dentists that are offering this service. Another is that a WITH Foundation grant has been approved for curriculum development around patients with special healthcare needs getting dental care at UCSF specifically and University of Pacific in San Francisco. That there has been a UCSF autism dental clinic created. So if you didn't know about that, you can inquire for your families who have children and adults with autism. There is a network called the Oral Health Progress and Equity Network that has popped up, and you can become a member of that. And within the Oral Health Progress and Equity Network, there is a disability and inclusion subgroup, so please join that. There will be a California Dental Association edition of their journal, which is dedicated to special health care, oral health care. That will be happening in June of 2022. I'll be guest editing that along with the chief of pediatric dentistry at UCSF, Dr. Ray, if you know who he is. Dr. Paul Glassman at California North State University, who's an expert on virtual dentistry. He is pushing for a regional study on dental care with behavioralists in offices. We hope that moves forward to involve Sacramento, Alameda, and San Francisco County. And then the Cal Health Care's loan repayment program has expanded to give preference to dentists who will be providing a special healthcare needs oral health care. And UCSF has made moves towards trying to get the intergovernmental transfer, draw down federal money for dental care through the School of Dentistry. Next slide, please. Now I'd like to pass the baton to Dr. Karen Raju, who's been working on these issues. Karen.
So much, Dr. Ben. And good morning, everyone. I'm Karen, a public health dentist, and I'm so glad to see that you all joined us today and letting us know about yourself by filling the poll questions. So I did my dental public health residency from UCSF in 2020, and during my residency, I got a chance to conduct an oral health needs assessment of children and youth with special healthcare needs by conducting surveys and telephonic interviews with parents or caregivers of children and young adults under 21 years of age. And as Dr. Ben described the current landscape of special needs dentistry, I want to let you know that the early and periodic screening, diagnostic, and treatment, commonly addressed as EPSDT, is the child health component of Medicaid. And this federal regulation states that all children under age 21 who are enrolled in Medicaid, they are entitled to EPSDT benefits. And that states must cover a broad array of preventive and treatment services. So basically, preventing disease before it actually happens is a real mantra here. However, it is well known that children and youth with special healthcare needs, they face multiple challenges that make them a vulnerable population. And talking specifically about the oral health challenges, children with cerebral palsy may not have the motor skills. They need to use a toothbrush safely, or even to sit still in a dental chair during the dental visits. And children with delayed speech and language development, they may not be able to tell their parents that they have a toothache. And the child in this picture may be perceived as a picky eater or a troubled child by some, but the reality is that he cannot communicate his pain while chewing. And even though he has his favorite food in front of him, he cannot eat. Also, did you know that sugar is added to some medicines to make them taste better? And other medicines used to treat cerebral palsy, seizures, and depression, they can cause dry mouth by lowering the amount of saliva. And saliva is the watery liquid in the mouth. So it plays an important role in preventing tooth decay. And medicines given to these children, they can cause dry mouth. So as you can all see, the effect of these medicines on the teeth of a young child, and this undoubtedly lowers the quality of life of these children. So what about children and youth with special health care needs, unmet dental care needs? So they definitely need more, but they are receiving less. And research shows that dental care is the most prevalent unmet healthcare need for this population. And a recent report, it highlights that although nearly 8 in 10 DDS consumers, they are eligible for Denti-Cal, only 22% of them, they received dental services in 2014 to 2016, as compared to 32% of Denti-Cal beneficiaries overall. Now, how about the quality of dental care received by the small percentage of special needs population? And in simpler language, what is quality of care? It is when the likelihood of desired health outcome increases with the healthcare services provided. So let's see this short video. But before I play this video, I want to add a disclaimer that you may hear a bunch of potentially offensive language. So you're free to mute your speaker while the video is showing in case you do not want to hear traditionally foul language.
You can say almost anything.
Right. Holy yeah.
You just had a baby.
Shit, yeah.
Congratulations.
Gong hei.
She's so cute, I want to barf.
Well, there goes your sex life.
You just squeezed out a human.
Does your vagina hurt?
I hope you are ready for lots of shitty diapers.
Yeah.
Behold, the miracle of barking life.
See, you can say almost anything.
The truth is, the only bad word is sorry.
Sorry.
You're supposed to be celebrating.
Woohoo! So don't be sorry about a baby.
Be happy.
Because every baby deserves a warm fucking welcome.
This is one of the great real-time videos I saw. And I mean, this is happening all across, starting from childbirth to healthcare settings, to grocery stores, even relatives, or in the job market. And why is this happening? This population is perfectly fine humans, but they're differently able, and they can do same things as typical person. And obviously they deserve equal treatment in healthcare and all other areas. Also thinking about dental care settings, it can be connected with the stories that parents shared with me during the interviews I conducted. So take a moment and think about the time when you or your loved ones visited a dentist and they had to hear sorry. Not because the dentist don't want to treat you, but because they were either not equipped to accommodate your child's special needs or had other administrative or logistic reasons. And here is what the families had to say regarding access to dental care in San Francisco Bay Area. Regarding perception of existing dental care system, One of the family members said that practitioners don't want to accept patients with disabilities and don't know how to work with them. Another family member said that practitioners say they are not discriminatory, but because they have no experience and don't know how to provide care, they don't accept patients with disabilities. That's functionally discriminatory. When I asked about sharing about their experiences of getting dental care for their child or young adult with special healthcare needs, one of the family members said that it was hard because the dentist didn't have patience with him, especially when he was screaming and he was very young. The dentist stuck the toothbrush in his mouth and then stuck another tool. And he was like choking and screaming and kicking and she was just like done. She literally couldn't handle it. And she walked away because she felt like she couldn't handle his screaming and his kicking. I mean, most of you may have had this kind of dental experience, but we know that these experiences can be traumatic and they discourage families to take their child to the dentist again. When in fact, we also know that how important dental care is for our kids. But there was one parent who had a positive experience and he shared that he found a dentist with specialized training. The dentist was extra gentle, allowed more time, and took gradual steps with dental care and inspections. When I asked about the barriers to dental care, this parent is a SF resident for a long time now, and she said that I had the time to research the dentist, to compare insurance, but it's just not clear. It's not marketed clearly, or the fact that I had to email back and forth with my pediatrician, whom definitely I love because I can talk to him on this, but he had to help me to find a dentist. This was ridiculous. And just FYI, even her pediatrician couldn't find options other than UCSF or UOP dental school. One parent said that general anesthesia is a big expense, and we know other families like ours spend a long time getting approvals and are sometimes served with an enormous bill afterwards. And lack of availability of dentists who accept Dentical is a major barrier. Also, I asked an interesting question to the parents that if you were the mayor, how would you fix these barriers? And we got many interesting answers, but I want to share a few with you. I would probably reach out through the government agencies that support people with disabilities. I think having more targeted outreach would be a good value of having those kids get seen by a dentist, obviously at least once a year, and then building a competence center with trained dental staff. One parent said that this is equally important as going to the doctor or getting your shots. And I don't feel that that message is that clear to me. I've been at SF since last 10 years, and I've never heard any kind of messages, even from my own pediatrician. I mean, he told me like once a year, just go to a dentist. So with this, I would like to hand it over to Dr. Kripke, who is an awesome parent advocate, and then we would love to hear your stories and suggestions on the topic. Dr. Kripke, the floor is yours.
Dr. Kripke, I'm just going to interrupt briefly here because I know you're going to be following up on the statement. One of the comments made is when we're looking at the poll, and the first question talks about, do you have a dentist that's fully able to care for your child? One comment was that fully maybe needs to be qualified, because when Dr. Raju brings up equality, we might have lowered our standards quite a bit. Access to that regular, those preventive checkups, that just can't happen for so many. So yeah, we might have found a dentist to care, but it's every couple years and it's in the hospital setting or under general anesthesia. And then another comment was the celebration and the feeling of thanks and gratitude when you find that one gem of a dentist that's willing to go above and beyond for your child. So I just, before we went any further, I wanted to mention that, and thanks for letting me interrupt a little bit.
Yes, there's many aspects of dental care, so thank you so much. My experience is both personal and professional. I'm a family physician who cares for adults with developmental disabilities, and I'm also the parent of a young adult who's a regional center client. I see that there are three main issues. First is home hygiene, keeping the teeth and gums healthy with daily brushing, flossing, and cleaning. The second is getting to the dentist and cooperating with exams. And the third is finding professionals with the expertise and the funding for their care. When my daughter was 3, she got a cavity. And that was a wake-up call for us because cavities are preventable with good home care. And as a doctor, I know that good oral health is important to overall health. Infections can spread from the mouth to other parts of the body. They can get into the blood. And dental pain is often missed in people who have communication or cognitive differences. It can be serious. Also, having a nice smile helps people with disabilities to make friends, to find jobs, to do well in school, and to keep good aides and caregivers. There's lots of reasons why we weren't doing a good job with brushing her teeth. She wasn't cooperative. We were overwhelmed. Our dentist didn't tell us about all the ways that we could work on it. All of the sweet food rewards at school didn't help. There are bite blocks that can keep the mouth open while you're brushing. There are special adaptive toothbrushes. There are positions for holding our daughter that work better. For example, instead of going like this, coming around from the side and steadying the head from the back. There are xylitol gums and sprays. There are water picks and suction machines, which insurance can cover. There are techniques for teaching her the skills to help, and there are books and videos to explain to her why it's important. And a lot of our kids don't get the dental education that other kids get. It wasn't until after we put dental hygiene actually into her IEP and made improving her daily mouth care a goal for school that we got the help that we needed. Her school and her therapy team helped us to teach her how to open her mouth and cooperate. And we got an effective routine down that worked for our family by practicing it at school and at home. She didn't get any more cavities after that. So the second thing, going to the dentist was never easy. It was hard when our daughter was small and we could still carry her and hold her in our laps, but it was impossible when she got bigger and stronger. We tried some medications to make her drowsy, and that helped a little, but not enough to get a good cleaning. We tried visits to the dentist just to practice sitting in the chair. We tried turning off all the bright lights and the noises. We tried switching dentists to find a calmer office that had a bigger room and more private rooms. We were flexible about doing the exam in the waiting room or sitting in a regular chair. We tried rewards. All of these helped some, but not enough to get all of the care that she needed. We kept going to appointments, but there wasn't an effective exam or cleaning at most of those appointments. We haven't given up though. We still work on those skills. Over a very long period of time, it has improved some. One thing that set us back was that we tried to restrain her without her permission. This did help us get a few things done, but in the long run, it made her more scared and more resistant. We meant well, but she was really traumatized by it, and I regret it. When I asked my daughter what I should share with you today, she said by communicating by pointing on her a letterboard, a tool that we didn't have when she was younger, she said, "Don't use restraint. Use medicines if you have to." Some kids like the deep pressure, and young children often feel very safe with a snug hold by a trusted parent or being in a papoose, and that's fine. But if a child or adult is scared by that, then I don't recommend using restraint. At different times, even with our best effort, our daughter had to go to the hospital to get anesthesia in order to get x-rays and a good full mouth cleaning, and to get preventive care like sealants put on the teeth so that she wouldn't get cavities. With anesthesia, we got the sealants on to protect her new molars. Anesthesia these days is very safe. There are risks with everything we do in medicine, but the benefit of good dental and oral care definitely outweighs the small risk. Our daughter had both Medi-Cal and private medical and dental insurance, but even with all of that, it still wasn't easy to find care. We still had expensive costs. The dentist took one type of insurance and the hospital took a different type. They didn't coordinate with each other. I ended up having to file a complaint with the Department of Managed Care to get it sorted out. In some ways, it might have been easier if she didn't have private insurance, because then Denti-Cal and the regional center would have been completely responsible for paying for the care and making it accessible to us. However, there aren't enough dentists who take Denti-Cal insurance. It really shouldn't be so hard, and it doesn't have to be. Dr. Glassman, the former dean of the University of the Pacific Dental School, and dentists like Dr. Alan Wong and Dr. Subar at the University of the Pacific have developed a virtual dental home program. Advanced practice dental hygienists. These are dental hygienists who know how to do cleaning, but also who know how to do good exams and who have additional training compared to a typical dental hygienist, can go where you are. They can go to your home or into the community to do cleanings and exams. And while they're there, they can teach caregivers how to take care of the mouth. If hospital care is needed, they help to arrange it. Some of these advanced practice dental hygienists work at the regional centers, so dental coordinators that were described. So they can work very closely with the regional center and coordinate with the insurance and the regional center and the families, schools, everybody involved. The dentists also work with Special Olympics, and Special Olympics has done a very good job of providing care during athletic events and health events. Many of the adults with disabilities who I serve as a doctor receive this type of service in their homes, where the advanced practice dental hygienist comes to their homes on a regular basis. Some schools have put this service into place so that dental care can be delivered at school with the help of school staff. This is a cost-effective resource and way of delivering care. It uses the resources of fully trained dentists and the dentists who work in the hospitals very well, because it allows the basic work to be done by the advanced dental hygienists, and only things that need to be seen by a dentist or seen in the hospital are there, and it reduces the amount of cavities and other problems that need to be taken care of in the hospital. It allows people to be patient and to receive care in a place that they're comfortable and well supported. It relieves caregivers, and most of all, it delivers a very high quality of dental care. A lot of the patients that came to me from institutions or skilled nursing facilities, or even from family homes, didn't have good oral care and have lost a lot of teeth. But once we get them into this program and start working with them, their dental care improves greatly, and they stop losing their teeth and their smiles improve. So we know what we need to do. We know how to do it. We have the models, and there's not enough, but there are many people who have the skills. And the problem, I think, is mostly funding, and it's not even the amount of funding, it's the way the funding is offered, because a lot of the funding sources respond to the needs of individuals instead of looking at dental care for our population as a public health issue, as this is a group of people, not just individuals, but a group of people who needs care, and how do we deliver care to that group of people. So I would love for you to share your family stories in the Q&A or on the chat, and for us to have a discussion now.
Thank you so much. There's been appreciation expressed around the practical strategies that you provided too. And clearly we have San Francisco well represented, but of course we're hearing from families around the state saying, well, that's not available here. Or we've had comments around the requirement of hospitalization, but we also know we've heard from families as well that that partnership between just getting into the hospital is a huge challenge in different regions as well. One of the questions, and I was just so moved by the recommendations that came out of the UCSF Dentistry Summit. It's so encouraging. I'd love to get a little bit more update on where we're going with those. But one question was, did the summit look to other states for models?
Yeah, so one of the key speakers was Dr. Ron Kaczynski from NYU, because NYU has created this state-of-the-art dental center for people with special healthcare needs, and their funding model is not perfect. They're having trouble getting government funding to continue to sustain the center, but there's a lot of private funding that's enabling them to continue to operate. In any case, he was a keynote speaker there and offering his guidelines. But yeah, there's a need for all the states to get on the same page about this as much as possible, because it's not just a California problem. It's definitely something that's affecting people all over the United States.
And hopefully with the Family Voices team around us, we can look at better ways parents can advocate to really take on this issue in their spare time when they're not trying to find a dentist. And speaking to, I'm going to say it outright, the desperation of families who are willing, it's expressed by their willingness to travel anywhere. One of the other questions was, are the services such as those at the Autism Dental Clinic at UCSF, are they open to others? How can families get in touch? And does DentaCal cover? In other words, if there's nothing in our area and we're at our wits' end, how do we go outside of our area?
So with the UCSF Autism Dental Clinic, it is relatively new. It is their capacity is slightly limited, but they're trying to increase the size of that clinic. I know at UCLA, they have programs. I'm encouraged as I talk to the dentists at UCLA that there is some dental medicine integration going on there and a real wish to expand services. As far as gaining access to the specific UCSF autism clinic, I think through the regional center is a great way to try and make that contact. The other is to just look it up online and reach out to the UCSF School of Dentistry about that. And hopefully you'll be able to get an assessment prior to getting an appointment. There is a lot of work for us to do on this, and I'm wondering if if maybe Karen can share her screen again so that we can talk about some specific opportunities to advocate around this issue. And I really appreciate Dr. Kripke giving that personal insight and the insight as an amazing physician providing care to people with special healthcare needs. So the first thing is that if you are in the Bay Area, and even if you're not, to push for UCSF, if you have any clout with UCSF or as a parent in your clinics there, asking UCSF to open a special needs dental clinic. That would be a very specific thing that could move us forward and continue to highlight the need for that. To advocate for Medi-Cal Dental to reimburse behaviorist services. So when you're talking about the challenge of getting anesthesia dentistry or hospital dentistry in the hospital, one way to get increased access to that is by providing reimbursement to a behaviorist who might be in an outpatient dental clinic, so that desensitization of, for patients with autism or with behavioral conditions, that they could get desensitization visits paid for, even if no dental care happens. They can get more and more comfortable being in that dental office, so that eventually we have more people going into dental offices to get their oral health care rather than having to be put under general anesthesia. And if we have less people needing to go under general anesthesia, that'll open up spots for those people who actually have to go under general anesthesia for their dental care. Most important for everyone on this who has contact with a regional center, not all the regional centers in California have a dental coordinator. So if your regional center doesn't have a dental coordinator, please talk to your case manager, ask them, could this happen? Could you get a dental coordinator paid for at your regional center? That would be a first step. And the second thing is, for those regional centers that do have dental coordinators, there's no standardization of what their responsibilities are. So trying to standardize what those things are, asking your regional center, please have a dental coordinator, and then will you standardize with the other regional centers what that dental coordinator's responsibility might be, so that everybody is getting hooked up with dental care as much as is possible in your regional areas. Approaching your local legislators to let them know that this is a problem, and for them to put this on their list of issues as something they should be legislating and advocating for. Advocating for your dentist and your doctor to work together, to talk to one another, make a phone call, try and have them come together and coordinate the care that they're providing to you, because I'll tell you, they probably are not talking with one another. And that would be a really great thing that you can push them to do. Also, as Dr. Kripke talked about, advocate for your school district to possibly offer dental care in the schools, especially related to special education. If they could actually pull dental hygienists who are specially trained to provide services in the school where your kids and young adults are spending time every day, this could be a great way for us to decrease the number of complications from lack of dental care that are occurring in our kids' lives. And then to join OPEN, the Oral Health Progress and Equity Network, in their Disability and Universal Inclusion Work Group, to get more voices pushing for this need for us to address this lack of oral health care, not only in California, but across the United States. And you can go to openoralhealth.org in order to find that opportunity. And with that, I just want to thank everyone who is learning about this today, and in being able to advocate so that we can push this train forward, since there is some momentum right now and good leaders at the state wanting to make changes to help all of our kids and families who need this. And with that, are there questions that we can try and answer in the last few minutes?
Yeah, there are a couple more questions, a couple of comments also. Dental care for our kids really shouldn't be a luxury, and it really is. And, you know, one parent commented, yes, we need to advocate like with everything else, but boy, do we get tired. And we try our best. So maybe with Family Voices and some other groups out there, we'll be able to get a platform to jump on the momentum that is taking place with all these efforts. So we can't thank you enough for giving us a little bit of hope and also listening to our woes. A couple of quick questions as we have about 6 minutes left. Some organizations really recommend hospitalization for any dental care for kids with special health care needs and or disabilities. Hospital access to the hospital, dental privileges are few and far between. So one parent has asked, do you recommend hospitalization or versus in the dental office when treatment, general anesthesia has to take place?
I think
Go ahead.
that it really has to be an individual decision. Some of the people that need special dental care have complicated medical problems like unstable seizure disorders or aren't able to protect their own airways when they eat, and so they're at very high risk of having a complication, or the behavior is such that you're going to need a very strong and expert team of people to help going into or out of the anesthesia. And so I think it's something to discuss with your dentist. What are the special needs of the person that you're supporting, and what are their behavioral needs, and then make an individual decision. But we don't have enough resource for everybody to do this in the hospital, and hospitals are sometimes scarier and stuff. So for our family, we've done both, and both have been successful. But to do it in the office, we actually had to bring help with us who could help us get the induction done, and without the help of that hospital team that could help us.
Thank you.
And there are freestanding surgery centers that offer some types of anesthesia with dental care, and Medi-Cal actually has recently given incentives for those surgery centers to contract with actual medical anesthesiologists rather than dental anesthesiologists. And that sometimes for people who have medical complexity that has to be dealt with before the oral health care can happen, it's important for them to get a medical anesthesiologist working with that dentist. And that can be difficult to find, but Medi-Cal is trying to increase those opportunities for oral surgery centers to provide that kind of care. But it's hard to find. And I also want to appreciate, we don't want to throw all of this advocacy in your laps like this is for you to do. Just join us. We are all advocates around this issue, and it's not actually part of my job in CCS, but I've seen complications that happen as a result of lack of oral health care. And so together we can advocate, and Family Voices hopefully will continue to pull us together in this way.
Thank you. Yes. The regional center dental coordinators, for those families who have children served by the regional center, that seems like a remarkable first step. I know that's been really helpful in helping parents find local resources. One parent has asked, how do I find an orthodontist who will care for my child? What is the process? Are there directories for that if we might not have a regional center coordinator, or we're not in touch with our local family resource center who might have some guidance on that.
Karen, do you want to speak to that one?
Yeah, so we do have like a state list under Smile California, Find a Dentist website, but it doesn't talk about the specialized dental care in terms of like people with disabilities, if the dentist has special accommodations. So I know this is like a national problem right now. I've been talking to several people, and recently I talked to UCLA people as well. So it's the same overall. And Cavity Free SF is trying to come up with a criteria to create a dental directory. So hopefully we launch something next year, but that's under process. But we do have like a Find a Dentist Smile California website, which you can reach out. And I know like most of the counties, they do have like a list of providers, which you can refer, but talking in terms of special accommodations, there is none.
Thank
Not
you
very
so much. We have run out of time, but for those who want to jump on this with you, we will be connecting with Family Voices on this, so we can definitely join your efforts. And on behalf of all of the attendees, thank you so much for your insight. Thanks for some hope. Thanks for some guidance, and thanks for understanding the challenges that families are facing. Thank you all.
Yeah.
Off to networking right now.
Thank you so much.
Thank you.